Hello, this is Nicole Barber-Kolb. Thanks so much for joining us today. We're going to go ahead and get started. It looks like some of you are in listen-only mode, but we are definitely going to open up the microphones to gather some feedback from you momentarily, and then give everybody a chance to introduce themselves as well at the beginning. So I just wanted to say thank you for hopping on and being with us this afternoon for the State Health Improvement Plan Obesity Workgroup meeting. This is the first of, I think we have about three or four, maybe three calls scheduled for this group. So thank you for being here for the initial call and starting this conversation with us. Like I said, I'm Nicole Barber-Kolb. I'm with the Coordinated School Health Program and Maternal and Child Health Division at the Department for Public Health. And I also am a member of the State Health Improvement Plan Committee. So Elaine and the rest of the obesity team will actually be our experts here today and will be presenting momentarily. But we really just want to make this engaging for you. And hopefully gather some feedback throughout the call. Please feel free to put in questions at any time, and we will answer them as we go. So let's just go ahead and get started. And we're just going to actually start with everybody introducing themselves. So we will open up your phone lines in just a moment. Introduce yourself and where you're from, and that would be great. See, Heather, do you want to start?
Sure. So my name is Heather Norman-Berghoff, and I am an assistant extension professor at the University of Kentucky. And with my extension appointment, I serve as an extension specialist in food and nutrition. And my area, I guess, focus would be chronic disease prevention through nutrition. And so actually, I'm new to this group, and a little bit of the work that you guys do, I started at UK in January, and I'm actually kind of filling in for Janet Mullins, who's an extension professor, but she is getting ready to leave the country for a study abroad trip. So thank you for having me.
Thanks for being here. All right, Amalia? Amalia, are you able to speak in your phone? We'll come back to Amalia. Corey, do you want to introduce yourself?
My name is Corey Donahue. I'm with the YMCA Central Kentucky and the Kentucky Alliance of YMCAs.
Great. And then Lindsay?
Hi, my name is Lindsay Mollis. I am the Health and Wellness Coordinator at the Human Development Institute here at the University of Kentucky, which is the University Center for Excellence on Developmental Disabilities in Education and Research.
Great. That's a mouthful.
I know, it's a lot of words.
Thanks. And then Melissa?
Hi, yeah, this is Melissa Brown. I'm with the American Heart Association. I am the grassroots director and sitting in for Tanya today.
Great. All right, Amalia. Well, Amalia, you can type it. Well, we can come back to you. We'll get you going in just a minute. Eventually. Did we miss anybody? Okay. We'll just keep going. Okay, So just moving forward in today's conversation, we're just going to kind of keep the idea of the mission of the Department for Public Health in line with our conversation today, and seek your input on ways to follow our mission and just gather input on moving forward with the Department for Public Health mission and vision. So how to improve the health and safety of the health population through creating healthier people and healthier communities. So that's kind of the foundation of today's discussion, and just really want to gain your insight and help us find some direction on how to move forward, specifically with our state health improvement plan. I know that you all, most of you attended the state partnership meeting in March, so that was really kind of the start of this conversation and timeline. So we came together, if I can get my words out, for that stakeholder meeting in March at the History Center in Frankfurt, and kind of had various discussions on what might be the top priorities of health issues in Kentucky, and obviously we're here today because obesity was one of those priorities. So we had everybody sign up at the end of that meeting. If you weren't there, your name was either recommended, or you might be sitting in for somebody who was at that meeting that may have signed up for that obesity work group. And so this is just our initial discussion to get this started. June 15th is when we're actually going to try to draft the goals and objectives from each of the 5 work groups to kind of start our initial draft of the State Health Improvement Plan. July 14th actually gives us that deadline as work groups to kind of get everything together and presentable, and then August 15th we're really just going to have all the comprehensive plan together for all the goals and objectives of each of those work groups. So it's obesity, ACEs, integration to access, substance use disorder, what am I missing?
Healthcare integration.
No, I got that one.
Tobacco.
Tobacco, goodness gracious. So those are the 5 topics, and that's what our health improvement plan will consist of. This is also just another timeline of kind of what we're doing specifically as the obesity work group, and really wanting to move forward in this direction with these specific dates, if at all possible. I know we have that June 7th as the last piece of discussion, but I think it can go a little beyond that if need be. But I think we probably have a good hold of maybe a good starting place for us, and you'll see that in some of the homework that will be sent to you after the phone call today. And then just a good place to start to maybe move forward in creating those measures and objectives that we are actually going to put into the health improvement plan. But we can't do this without your input and feedback, and to help us move further with this, we really need that. So please make sure that you communicate with Elaine as much as possible on this, and myself, or Shelley Wingate. You've seen their information in the emails that I've sent, and obviously all of our contact will be sent in the follow-up emails to this phone call as well. So I guess, let's see. The last part, this ship components and what we're actually trying to identify. I'm not going to read these off, but you can just look on your screen and kind of get an idea of where we're going in terms of building this plan for each of these 5 work groups. So these are the outcomes that we're working towards, and obviously we need your help in that. So for today's agenda, we are going to start with just an overview and history of the Partnership for a Fit Kentucky work group, so you guys get a kind of an idea of what is already happening at the state level in terms of obesity initiatives, and what subgroups are involved with that partnership for Fit Kentucky umbrella. So then you'll get a bigger breakdown of what actually happens. The partners that are involved already with that work, and then we'll move into the homework piece. So with that said, I think Elaine is up. And please, like I said, feel free to type in any questions that you may have, or we are always welcome to pause and clarify as need be. Elaine?
Hi, this is Elaine Russell, and I'm the Obesity Prevention Coordinator, and I oversee the CDC 1305 grant. I think most of you all have at least heard of the partnership. Everybody's name is pretty familiar to me, so you might not have been around as long as I have. So I'll just give you a little bit of background of how the partnership got started, and some of the things that we've accomplished, and let you know about the partners. This is what I heard at the meeting in March that people wanted to know. I'm not going to go in full detail, so you'll also have a little bit of homework if you want to listen to a full detailed webinar of all of our work, and we also have some vision documents that you can go through as well. So to start with a little bit of the history, back in 2003, we received our first CDC Obesity Prevention Grant. So we weren't really talking about obesity before 2003. We put together a team of stakeholders that were representative of all of the regions across the state. So we had 9 different regions, and we had experts in nutrition, physical activity, evaluation, and just some very passionate people throughout the state come together. With this first grant, they really said that let's just build capacity and understand what the data is and what's already going on. So in 2004, we released the first obesity epidemic burden document. And this was kind of a big deal. Nobody had really talked about the numbers of obesity. So this got a lot of traction. We followed this up with 9 regional forums, and we went around the state and we asked people, what are you doing around nutrition and physical activity, and what would you like to do? We also talked about what the evidence-based was, and what we learned was a lot of people were already working on this, and it was just kind of scattered. They were all doing the same things, but the names of the programs might be a little bit different. So there was a real need for coordination. So with the information that we gathered through those 9 regional forums, we put together the state plan. So this was back in 2005, and if you look back at this plan, you can see that we have really progressed, and we have really stronger initiatives going on. But this was a really great start to kick us off with. So the next thing we did was we tried to put together regional coalitions. We didn't have a whole lot of funding to give to coalitions. We made these regions similar to ad districts, and what we learned is everybody's got to make their own boundaries of coalitions and who they want to work with. And we have to let them come up with their own strategies to work with. But there is a need to have this cross-pollination throughout the state. So there's many coalitions that are still going, but they have gone more of a local instead of a regional area. So in 2009, the state received funding from the Council on State Government. So this was where this was required to work with our state legislators, our Commissioner of Public Health, Commissioner of Education at the time, and what we decided to do was have a leadership team, and we identified 8 policies to really focus on in Kentucky. And if you look back at those 8 policies, we have not fully accomplished any of them, but we have made progress in all of them. In 2010 and 2012, we received funding from CDC for the Communities Putting Prevention to Work, and it was just to work on 2 initiatives, and that was early care and education and farm to school. So we were able to put together 2 really great coalitions and really get to know the stakeholders in each one of those. We were able to pilot some projects and really find out what was needed. These are probably continue to be two of our strongest initiatives. The Department for Public Health continues to lead the Department of, or the Early Care and Education work group, and then the Department of Agriculture has taken over to work with the Farm to School. So many of you may work with Tina Garland, who leads that. So there's been additional funding that has come through that, and these are two still thriving initiatives. In 2012, with some help from the Foundation for a Healthy Kentucky, we developed some stories to follow up with our policies. So we showed some local policies and environmental changes that have happened in Kentucky. We know people resonate best when we talk about what's happening in our own state versus what we hear in California or New York, in an area that we don't really connect with. So you can see different stories around schools, early care and education, breastfeeding, that are all right here in Kentucky. And all of this information is on our website, and you have the link to that. Or you will by the end of this. She asked questions. We do have a few strategic plans already. So there's a breastfeeding strategic plan. And this is led by our Kentucky WIC program. So this looks at the different initiatives that we could work with around breastfeeding. A lot of people don't understand that this is an initiative. Breastfeeding is one of the evidence-based behaviors that leads to obesity prevention. So it helps, their objectives include supporting moms and their families, making sure that people understand why breastfeeding is important. Also to support our peer counseling program, our baby friendly, which is a 10 steps to baby friendly hospitals. So when moms have their babies, the babies are in supportive environments, as well as making sure when mom goes back to work that there's in supportive environments with the work sites and with the child care. So those are just a few of the initiatives that our breastfeeding group works on. I think it was back in 2014, maybe 12. We did the Unbridled Health Plan, which is very similar to our state health improvement plan. We worked with partners to put together a plan that we could work on in a coordinated fashion with chronic disease and health promotion. So we have both clinical and community initiatives in there. So I think this plan was a 5-year plan, and that time has been up. So it is time to update this too. And you'll also see on the Partnership for a Fit Kentucky website that we've put together our strategies and objectives for the different initiatives that I'm getting ready to talk about as well. So we do have funding for obesity through CDC. We are in our 4th year with the CDC 1305 funding. This is also a coordinated fund through CDC that we work with school health, diabetes, and heart disease and stroke. We're also on our 3rd year, with NMORS funding, and this is specifically to work around early care and education. And we've worked with learning collaboratives. So we bring together about 25 child care centers in a region, and we provide them with training and technical assistance and resources. And then they are able to network with one another and learn from one another. Other funding we have is with the local health departments. So we're partnering with the maternal and child health funding and with the community health action teams. So we're just trying to make sure that we're all in communication, coordinating, and working towards that same goal. So I'm getting ready to send you right after this email, or Nicole is going to send you. It's a long list of all of our partners. This is one of the things that people were most interested in, was who are we already working with. So as I said with breastfeeding, our Kentucky WIC program leads that initiative, and with our 1305 funding, we're required to work on one initiative, which is the baby-friendly hospitals. So there's 10 steps with that. They've partnered with the March of Dimes, to pilot a recognition program to identify the different baby-friendly hospitals in Kentucky. Right now, we just have one, but we're working on it. This group will provide training and technical assistance to the hospitals on each one of those steps. So I've talked a little bit about early care and education. With the NMORS funding, we've been able to hire a coordinator for this project, and that's Rebecca Duchette. So she's been working with that funding with our learning collaboratives. We've impacted over 169 different early care and education programs with over 14,000 children that are impacted through that. So we work with the Division of Child Care, the Governor's Office of Early Childhood. We also work with UKHDI, Cooperative Extension, and several other partners. So it's a really collaborative partner. There's 5 different learning sessions that each collaborative go through, and during the last collaborative, we bring in community partners so that the early care and education programs can know their different resources in their local community. So the Department of Education and our own Nicole Barber-Colt that just spoke lead our school initiative, and we have a memorandum of understanding, so we work together closely there. They also work with the Alliance for a Healthier Generation, the Go 365 through that used to be Humana Vitality. So they work with schools on improving their wellness policies, along with a comprehensive school physical activity, and also staff wellness. So that also leads us into the worksite wellness group. So with our worksite wellness, we no longer have our worksite wellness coordinator, but we've done a lot of work in worksite wellness, working with the Chamber of Commerce, also again with state government, and we have a pilot program here in the Department for Public Health with a wellness committee and staff leadership, along with working on food service guidelines. So we work with the Better Bites menu labeling program. So here in our 3 cafeterias in Frankfort, we've worked on making sure that everybody has access to healthy foods in our cafeteria, and they know that with our Better Bites menu labeling. So in the schools, they also work with the staff wellness and their SWARM program, where teachers can be role models around physical activity and also get incentive points when they are physically active. So our last 2 are within the community, so it's access to healthy foods and access to physical activity. So with our CDC grant, we were able to choose between some strategies, and we are working on farmers market to improve access to healthy foods. So we work with our Community Farm Alliance, the Department of Agriculture, work with the different programs that have federal nutrition benefits. So the WIC Farmers Market Nutrition Program and the Seniors Farmers Market Nutrition Program. And we're trying to have more markets accept those different nutrition benefits and put in incentive programs. So one of those is the double dollars, where you can use your SNAP dollars for up to $10 and then get another $10 worth of funding. So that helps purchasing power for people with low income. What we know is we've got to work on training and technical assistance around the organizational structure, making sure that they have farmers market managers at the market, and promotional information. So with access to healthy, to physical activity, we work with our Kentucky Transportation Department, our Main Streets programs, and a few other partners. And really we're trying to work to make sure that we improve walking and walkability. So we're borrowing the call to action from the former Surgeon General. So we want to make sure that everybody is aware that they need 30 minutes of physical activity and that they have a place to do it. So the Transportation Department helps us provide training around how to develop your own pedestrian plan. So that is the quick and dirty. That is why you need more information from our webinar and some of our vision documents, so you can have more information. So what we have learned from our different committees is that when we bring them together, we try to learn what everybody is doing and what's missing. And there's a need for each one of these initiatives to have strong training, technical assistance, and resources to help implement some of these strategies. And what we have found is the biggest struggle is that you need more community engagement, that there's not a dedicated staff to make sure that these initiatives get carried out. So our partners usually do the more technical training, whether it's pedestrian planning or around farmers markets and making sure you have a market manager. And the Department for Public Health is taking the lead for community engagement. So hopefully most of you all are signed up for our community engagement webinar that is at the end of this month. So we'll make sure to send that link as well for you. So what we've heard is if you want us to have a policy or a systems change, give us the training and technical assistance. And then if you want it to stick, we have to engage the community. So until we really get those two things down, can we really work on the policy, systems, and environmental change. But that is the goal, is to make our initiatives a little bit more sustainable through policy change. So you will get a copy of this slide, or all of the slides, and you can click on the different icons to get to our websites and our initiatives to learn more about our partners and what we're doing. And we also try to make sure that everybody knows what's happening and we're networking what works. So you can go to our webpage and sign up for our listserv. We also are on Facebook and on Twitter. We think this communication is really important to make sure that we show success stories that are going on and make sure that we keep up to date about who's providing funding and any type of training opportunities. So make sure you sign up for our listserv so you can continue to get this information and you can share it with others as well. So just a little bit about our data. I think we talked a lot about data in our March meeting, but just to put us all on the same page, you can see that with our children, and this is WIC children, so it's aged 2 to 4 years old, we have 13% that are obese and about another 13% that are overweight. When we look at adolescents, and this is high school students, right?
Yes.
And they're 18% obese and 17% overweight. And then with our adults, through our BRFSS data, we have 34% that are obese and another 32% that are overweight. So if you look at this, it's about 13% for children, and they don't go up that much through high school. So what is that, 5% about? And then in high school, and then as adults, you see it's about another, it goes up to from 18% to 34%. So we put a lot of pressure on the schools, but we really have to give the schools a lot of credit because they're doing a pretty good job of maintaining the weight right there. So we need to kind of up our game with children before they get into school and then after we graduate from high school. We do have some good news in Kentucky. So we are seeing signs of progress in the WIC data. What we know is from 2010 to 2014, we've seen a 5% decrease. So we had the largest decrease of all the states. And so this is really good news to celebrate. We are below the national average. So the national average, I believe, is around 14%. But we still have a lot of work to do. In 1992, I think the national average was around 8 or 9%. So we have a lot to do before we get down to that. So the root cause of obesity, of course, is access to healthy food and physical activity. And what we hear is that 1 in 5 adults report that they have difficulty finding a fresh, affordable, fresh produce. And many Kentucky communities have at least 25% of the population participating in a federally funded nutrition assistance program. So that could be, again, like SNAP or WIC or the seniors. We're not doing so well as adults either for meeting our physical activity guidelines. Only 16% meet the 150 minutes recommendation. And we don't have a lot of access for safe walking because 68% of children have access to walking paths in their neighborhood, which really that seems kind of high to me. So we talked a little bit about breastfeeding. That's one of the evidence-based behaviors. And then the other behaviors are the, you can see here in our 5210. So it's increasing fruits and vegetables, decreasing screen time, not just because it's sedentary, but there's a lot of food marketing. Also increasing physical activity and limiting our sugary beverages. So the 5210 are the serving sizes that we suggest for 2 to 5 year olds. It changes a little bit before you're 2 and after you're 2, but it's 5 fruits and vegetables, 2 hours of screen time, 1 hour of physical activity, and 0 sugary drinks. So we provide this campaign to make sure that people understand why we're doing these changes. We don't think that this is an education campaign and this will result into behavior change, but we believe that if you understand why we're making changes in policies in your child care, then parents will understand a little bit better. So we want to make sure that we spread this message. So when we look at the evidence base, we can look to CDC. They have the health impact in 5 years. So it says the High Five. When I first saw High Five, I looked for 5 different initiatives, but don't get confused. That's not it. It's the health impact in 5 years. So they looked at different initiatives that will have an impact within 5 years, that are cost effective and will impact the largest amount of population. So they look at the social determinants of health. So you can see this as early care and education, clean diesel bus fleets, public transportation systems, home improvement grants and loans, earned income tax credits, and water fluoridation. So these aren't your normal initiatives that you would see for obesity prevention, but these are some of the things that could be the root cause of some of our chronic diseases. So this should impact, I think it's 14 different diseases or indicators. And you can see, so not exactly just nutrition and physical activity in early child care, but an overall quality child care. So with changing the context, you can look and see the list of different initiatives there too. So if you look at the ones that would pertain to obesity prevention, you can see the school-based programs that to increase physical activity, safe routes to school, and then a multi-component work site for obesity prevention. So part of your homework is to tool around on the CDC High Five. So we can look and see what these different interventions are. You can see what the evidence is and how they came up with the cost effectiveness and some of the frequently asked questions. So this looks at community-wide interventions instead of clinical interventions. And I also wanted to make sure that you had the information on this new equity framework. So this came from the National Academy of Medicine, and it looks at equity with a people-oriented lens. And they say, really, when we look at an intervention, we can't just look at one piece of it. We need to think about how we can increase healthy options while we're simultaneously looking at how we can reduce deterrence to healthy behaviors. So if you think about the food marketing, the higher cost to healthy foods, whether or not you have safe places to walk, if there's discrimination or social exclusion, and those are just a few examples. We also want to make sure that we look at social determinants of health. So we want to look at things that we can improve the social and economic resources. So it could be things like increasing the minimum wage, the tax credits, housing subsidies, education, job training, economic development, anti-hunger programs. And then that community engagement piece that we've learned so much about through our different grantees, we know that that's really important. So we also want to look at a component that will look at how we can build community capacity. So how can we empower our community? And when we talk about that, we really want to think about the community that's most affected, the most vulnerable population. So that would be a different group than some of our strategic partnerships. And we need both. And we need both of them to be at the decision-making table and both have power in some of the decisions making. So we have to educate our community about what these healthy behaviors are and some of the evidence-based behaviors. And we want to know a little bit more about the behavior change and knowledge and help them build their skills. So these are 4 things that we really want to make sure that we work on. So there is a link to this article so you can learn more about that. So that is, oops. So that's your homework, is to follow up with our partnership documents and web pages. You can tool around with the CDC High Five and the getting to know, getting the equity through obesity prevention. We've also put in a link for the Oklahoma State Health Improvement Plan. And then we're going to send you a Survey Monkey with some questions. We want to learn about what you're already doing and what you would like to see. Were you doing? Okay. And then we'll have another call. I think it's on the 23rd. Okay. So, so our next steps will to really come up and find out what type of strategies we can work on if we want to expand upon any, what our priorities are. So this, again, it would be a state level group, work group. So with that, let me just pause here and see if you have any questions, and Shelley will be unmuting if we can figure this technology out.
We're trying to unmute the mics. Does anybody have questions right at this moment? I know this is a lot of information.
So you can always write it in your questions.
Yes.
If we can't unmute you. And I think you can raise your hand too.
Yes. So here's your options. Raise your hand, write in questions, or you can just speak into your microphone or phone.
Okay, I think everybody is unmuted.
Is this overwhelming to you all? Is this a lot of information? We just wanted to be sure to be able to give you an idea of kind of what's happening with the partnership for Fit Kentucky, just to kind of lay out the already established initiatives and see maybe how your work can build on that, or if it's something that you feel like your agency can contribute to. So these will also be questions that we talk about in the homework as well, and the Survey Monkey that you get sent out, but it's kind of good to have everybody on the phone just conversing about it as well. So if you have any input, feel free to take a moment and let us know now.
Oh, she's self-muted too. So these two are self-muted. That's not good.
You can also, you might have to unmute yourself from your end as well. So if you're trying to talk and we can't hear you, that might be part of the issue too.
And remember, you can type in a question or a comment.
Oh, now I hear somebody.
Well, I hope you look forward to reviewing some of the documents that we'll be sending you. And you can see what the Oklahoma State Health Improvement Plan looks like. So this will just be a big overarching view of what our state health improvement planning can be, and then we can continue to work on some of our more detailed interventions, and you can join any of our committees if you're interested. Just email me and I'll put you on our list for our next meetings. So here's everybody's contact information you would ever need. So I'm here at elainerussell.ky.gov. Shelley Wingate can help you, as well as Nicole. Jamie Sparks can help you with schools. Rebecca can help you with early care and education. And Marlene Goodluck can help you with breastfeeding.
So those are specific program emails, but if you have a specific question regarding the process of kind of drafting the state health improvement plan, just be sure to email Elaine, Shelley, or myself, and we would love to communicate with you via email if that's easier, if we have some phone shy people on the line. So but yeah, if you have any questions, please email us. We'll get that homework out to you. Please take time to do the SurveyMonkey, because really we can't do this without you, or do this the most effective way possible without you. So we really do need that input. And like I said, we'll get that out to you hopefully to the SurveyMonkey definitely by tomorrow, but the rest of the homework I've actually sent to you in your email. So some of you should have that. I might need to forward on a couple more people, but I'll double check that when I get back to my desk, and then we'll send everything out to you between this afternoon and tomorrow in terms of homework. With the archive webinar that Elaine was referring to earlier, I think that will be ready maybe Monday or Tuesday. So for that full archived Partnership for a Fit Kentucky webinar, we will email that out early next week to you. But the other homework you can kind of start looking at and reviewing pretty immediately, and then please feel free to, like I said, call or email if you have any questions. And we look forward to working with you and getting back with you on the 24th. And if anybody doesn't have any questions, you are good to go, and we will talk to you soon. Thank you.